Hello and welcome to Athena Women's Clinic YouTube channel. I'm Dr. Kaya Soma. Today we will talk about a topic that is affecting millions of women worldwide, iron deficiency. Did you know that iron deficiency is one of the most common nutritional deficiencies affecting women? From feeling constantly tired, fatigued, and having some hair loss, there can be many other symptoms which you may not be directly associating with iron deficiency. But don't worry, today we will uncover the causes, the symptoms, and the management aspects of iron deficiency. Worldwide, iron deficiency is one of the leading causes for the global disease burden. It's the leading causes of iron deficiency anemia, almost causing 1.2 billion cases globally, the last that was recorded in 2016. What about Australia? In Australia, iron deficiency is still commonest cause of iron deficiency anemia. So an estimated 34% of Australian women struggle with iron deficiency anemia. Premenopausal women, socially and culturally and linguistically diverse women, and indigenous women are at the highest risk. What happens when there's iron deficiency? There can be lack of focus, lack of concentration, fatigue, tiredness, contributing to the overall reduction in the productivity of these women. So what is iron deficiency? So there's two aspects to this. The first one is iron deficiency, as in low storage iron, or iron deficiency anemia, which is a consequence of low iron affecting the hemoglobin, which is a protein that is carrying the oxygen in the blood. Women of childbearing age are particularly affected by this condition, especially because of the menstrual loss. Pregnancy, the demands of pregnancy and breastfeeding can reduce the stores of the iron in a woman. So what's the reason for the iron deficiency and what are we missing? So let's start first with the causes. And if your diet is not rich in iron-rich foods like red meat, poultry, fish, eggs, or fortified cereals, then also you're likely to have iron deficiency. So like with the economy, this is a pure profit and loss or demand and supply equation here. So if there is excess demand outweighing the supply, then there's going to be iron deficiency. Or if the demand is not met with the supply, then again there will be iron deficiency. So the causes, first things first, poor diet. So if you're taking a diet that is not rich in iron, then that can result in iron deficiency. Or combination of foods that are not allowing good absorption of the iron will also result in iron deficiency. The next cause could be due to impaired absorption. So that's mainly related to your gut or digestive organ, where the absorption of iron is not at its best. This could be due to some pathologies that's involving the gut itself, like inflammatory bowel disease, celiac disease. Now, the third cause that we are talking about today is excessive loss. So, as mentioned earlier, the demand and supply. If the loss is excess and the demands are not met, you can be having iron deficiency anemia. So what causes this loss? So in women, generally the condition is excessive blood loss or abnormal uterine bleeding or neuralgia. What are some of the symptoms that you may experience? Sometimes it is likely that you miss the subtle symptoms and you may not notice it until it is really severe. So the symptoms that you may experience are tiredness, fatigue, lack of concentration or focus, headaches, dizziness, palpitations, or shortness of breath. Some of the other symptoms that you could experience are hair loss, brittle nails, or you may just look pale and tired. So if you're struggling with any of these symptoms, please see your own healthcare provider to get some testing organized. Don't worry, it is a simple and easy blood test and treatment is quite easy and handy, so no need to panic. So the two basic blood tests that we do to diagnose iron deficiency is hemoglobin and the iron studies. The hemoglobin tells us, as mentioned earlier, the oxygen carrying capacity of the blood, and the iron studies tells us the storage iron level. So the difference between the two, your hemoglobin could be normal, but you could still have iron deficiency. But if the iron deficiency or the storage iron deficiency is present, it could be associated with low hemoglobin, then it becomes iron deficiency anemia. So what are the treatment options? First things first, dietary changes. So it's important that you take iron-rich diet such as green leafy vegetables, so spinach, broccoli, Brussels sprouts. Also important to incorporate vitamin C along with that. Also include plenty of lean meats, seafood, lentils, iron fortified cereals in your diet to help with your iron levels. So the second option in terms of management or treatment would be to deal with absorption issues, mainly involving your GI tract or gut. So if there's any issues with celiac or inflammatory bowel disease, please seek appropriate treatment accordingly with your health professional to correct that underlying cause so absorption may improve. Continuing with this, if there is excess blood loss, so if there is any gastrointestinal or bleeding from the gastrointestinal tract or abnormal uterine bleeding, then that needs to be resolved so the loss is limited, which will again improve the iron stores and consequently the hemoglobin concentration in your body. So the next option, if you've corrected your diet and if you've managed to make sure that your absorption is all good, then supplements may be the next process that you may have to seek. In terms of supplementation, there's both oral and IV supplements. Oral supplements are in the form of tablet. Yes, it does take a few months for the effect to be noticeable, but it is still a good and effective mechanism of treatment. The alternate option, if we want faster results, would be intravenous infusion therapy. If this is something that you want to consider, please speak to your own healthcare provider. Why is it important to treat iron deficiency? To improve the cognitive function, improve the focus, concentration, fatigue and tiredness, improve the general energy, and also to reduce hair loss and generally to feel better. Alternatively, you can contact us at athenawomensclinic.com.au to make an appointment for further discussion about these options as well. And as you all know, prevention is always better than cure. How do you prevent iron deficiency? First, the dietary supplementation. So eating a healthy, balanced diet, which includes high iron, such as red meat, lentils, fortified cereals, along with vitamin C supplementation to help with the absorption, will help improve your iron stores. Avoiding excess caffeine intake, which inhibits the absorption of iron, will also help with your maintenance of iron levels. Regular health checks to make sure that your iron levels are at its optimum would also benefit you. Last but not least, educating yourself about iron and its importance will help and reduce iron deficiency as well. Thank you for watching this video, which I hope has helped in unraveling the mysteries of iron deficiency. If you like this video, please don't forget to like, subscribe and share with your friends. Thank you for watching.